And now I'm thinking I'm throwing it over to Jean. Yes, there we go. Thanks, Jean.
Thanks, Matt. Hello, everyone. My name is Jean DeHaan, and I am the current program head for high acuity specialty nursing. For those who are unfamiliar with high acuity specialty, in true teacher fashion, let me begin with a definition. So high acuity nursing practice lives between the regular medical surgical units with patients admitted with acute illness and the intensive care unit that admits patients requiring life support. So in high acuity, nurses closely monitor patients to manage their complex acute illness and or identify a worsening illness status so we can address these changes early and use advanced interventions that may not usually be available on medical surgical units. Next slide, please. So there are a wide variety of learners who enroll into the high acuity specialty nursing program. We have BSN students who take our first foundational theory course, followed by our virtual clinical course. We have RNs with a nursing diploma who complete our advanced specialty certificate and use it to obtain their Bachelor of Science in Nursing via the BCIT post-diploma BSN program. And this was discussed earlier in our presentation by both Kathy Kennedy and Jan Morrison. We also have RNs that already have their BSN degree, but who are advancing their nursing knowledge and their skill set to work on these specialized high acuity units. So high acuity nursing is becoming, I would say, more and more relevant on general medical and surgical units. The patients on these units are sicker today than they were maybe even 10 years ago. And honestly, I anticipate that patient acuity will continue to increase over time, as it has over the last several decades. What high acuity specialty nursing education will afford you is a way to revolutionize your nursing practice, to care for patients with complex acute illness that have concurrent multiple health challenges. Currently, BCIT offers the only high acuity certification program in Canada, and the program has received accreditation by the Canadian Nursing Association. The high acuity program is offered in two ways. The first is a part-time option, which takes on average about 2 years by distance education. So that would be one course per term for you to complete at your pace. The second is a compressed timeframe option, which completes in 19 weeks, which is equivalent to about 2 terms. So you can decide how slowly or how quickly you want to complete the program. That said, I invite you to contact me directly to discuss options in our course offerings to accommodate both your personal and professional needs. Coming up next is a video testimonial from one of our recent graduates, Catherine Duncan.
Hi there, my name is Catherine, and I recently completed the Advanced High Acuity Certificate at BCIT. I completed this specialty nursing program as part of the training for the Burns Trauma and High Acuity Unit at Vancouver General Hospital. I applied to a high acuity unit after around a year on med-surg because I was ready for a challenge in my career and a fast-paced environment where I would have the opportunity to think critically and advocate for very sick and complex patients. Because of the nature and complexity of caring for high acuity patients, I'm very grateful to have the additional training under my belt. I can speak directly to how the high, of course, a motorcycle. Okay. Okay. Hi there, my name is Catherine, and I recently completed the Advanced High Acuity Certificate at BCIT. I completed this specialty nursing program as part of the training for the Burns Trauma and High Acuity Unit at Vancouver General Hospital. I applied to a high acuity unit after around a year on med-surg because I was ready for a challenge and a fast-paced environment where I would have the opportunity to think critically and advocate for very sick and complex patients. Because of the nature and complexity of caring for high acuity patients, I'm very grateful to have the additional training under my belt. I can speak directly to how the high acuity program at BCIT equips nurses with the knowledge and clinical exposure they need to succeed in high acuity environments. What do I love about the program and career? One of my favorite things about the program was how relevant I found the material to my everyday practice. For example, in my current role, at the start of every shift, one of the first things I do before report is print out a cardiac rhythm strip for my monitored patients. The dysrhythmia interpretation and management component of this program gave me the confidence to interpret a wide variety of cardiac rhythms and readily identify concerning findings. The theory taught throughout the program was supported by case studies and clinical anecdotes from the instructors and my peers that brought the material to life. The instructors were great at not just telling us how things work and why, but also explaining why we need to know this and how it applies to our future patient populations. The oxygen supply and demand framework that serves as the center of the high acuity theory courses is incredibly useful. From the framework, I've developed a shift in my understanding, and this allows me to consider end organ perfusion in my patients in a way I never had before and anticipate worst case scenarios. Several different opportunities for simulations throughout the program allowed us to apply our learning, think critically, make mistakes, and grow as nurses in a safe environment, which allowed us to build our confidence for clinical. The clinical placement gave me a solid foundation coming into my unit orientation. I was given sufficient exposure to a wide variety of patients to meet my learning goals. I appreciated clinical debriefs where the students and instructor had the opportunity to learn from each other and discuss our learning in a collegial, judgment-free environment. My clinical instructors were fantastic, patient, and provided useful, constructive feedback. It was great to have the opportunity to learn from their experience and integrate some of their clinical pearls into my practice moving forward. My favorite thing about the nursing profession is the privilege of caring for people on their worst days and supporting them and advocating for them throughout the challenges of illness and hospitalization. In addition, it is very rewarding to bring the nursing perspective as a valued member of a well-functioning interprofessional team. I think nurses bring care, compassion, and humanity to life in all of the work we do, and I'm proud to be a part of that. Where do I see myself professionally in 5 years? One of my favorite things about my current unit is that with the variety and complexity of patients that we see, I feel like there are always so many new things to learn. I'll continue to seek out environments where I'm challenged and can further develop my critical thinking. I hope to expand my knowledge by continuing to seek out additional certifications and education. For example, just 6 months after completing the high acuity program, I just recently obtained my ACLS certification, which was recommended to me by both of my clinical instructors. I learned from the codes I've attended in person and from the ACLS course that I'm very interested in resuscitation and the incredible teamwork and knowledge needed to keep someone alive. I plan on pursuing additional training in critical care and eventually completing a master's in nursing to further research and education in the nursing field. I also see myself as a clinical instructor with the hopes of eventually becoming a faculty and teaching the next generation of nurses. I feel very grateful to have had the opportunity to complete the BCIT High Acuity Specialty Nursing Program, and I highly recommend it for students looking for a challenging, highly rewarding specialty where their assessment makes all the difference. Whatever you choose to pursue, I wish you the best of luck in the nursing field, and I look forward to maybe working together in the future. Thank you. Take care.
Yes, thank you so much. So if you would like more information about high acuity specialty nursing, please feel free to email me or our program assistant, Stephanie Wood, and we can answer any questions for you. Thank you so much for your time, and we really look forward to hearing from you. Thanks.